All right, switching gears, but staying with the health theme this year, nearly 80,000 Americans will be diagnosed with bladder cancer. Among men, it's the fourth most common cancer. Men are 4 times more likely to be diagnosed with the disease. And ladies, listen up. Symptoms can be subtle, especially in women. Here to share more as we enter Bladder Cancer Awareness Month, Dr. Jean Hoffman-Censits. Thank you so much for joining us.
Well, thank you. Thanks for having me and to bring awareness to this disease.
Yes, and this month is the month we're going to do that, right?
Yeah, Bladder Cancer Awareness Month is May.
Let's talk about the ladies and then let's talk about men. Women sometimes, you tell me, suffer sometimes from UTIs over and over again.
Well, what happens when the most common presenting symptom for bladder cancer is blood in the urine.
Okay.
And for men, that's usually an alarm sign. They're
Right.
on the phone with their urologist the next day and they're seen quickly. For women, they're used to seeing blood in the bathroom.
Right.
So they might be treated for a urinary tract infection, sometimes over and over again, when really the diagnosis was bladder cancer. So they typically have a delay sometimes in their diagnosis, and then because of that can present at a later stage and have worse outcomes.
So tell me your advice for women.
I would say if you have blood in your urine and you've seen your doctor and been treated and you still have blood in your urine, then talk about seeing a urologist to take a look inside your bladder, or at least think about being tested for bladder cancer. A special test to look inside the bladder, imaging studies, or even a camera inside the bladder.
Now tell me, research findings, we're making some progress, doing some good work there.
Yeah, so we are making some progress. Bladder cancer comes in a localized disease that's a superficial. Usually a urologist can scrape the inside of the bladder. For that kind of disease, we treat with an immune agent to stimulate the immune system to fight the tumor. And we're working at Jefferson with additional medications for patients whose tumor does not go away with that initial treatment. There's also systemic immunotherapy, so for patients with locally advanced or metastatic disease, where we need to treat with IV chemotherapy, sometimes surgery and radiation. We now have new systemic treatments that help the immune system to fight the disease.
That's good.
Yeah.
Are there any other signs that you should look out for other than blood in the urine? Are there any other things that will happen that you can say, this does not seem right?
Yeah, blood in the urine is very irritating. So oftentimes people who present with bladder cancer feel like they need to go to the bathroom frequently, or they go and they feel like they have to go again. They don't feel like they empty their bladder completely. Belly pain and problems with bowel movements, weight loss, those are oftentimes signs of advanced disease.
Okay, got it. Thank you so much for joining us.
Thank you.
We appreciate your perspective.